Hello everyone. I hope that you're doing all well. So we are now discussing a very important video which is very much related to our present situation. That is a detailed information, or you can say the analysis of coronavirus, presented by me, Syed Shujathullah. This is our flow of lecture. The students who are watching me, if they are aware of any of these topics, okay, so they can skip some of the video and directly go to that particular lecture or slide and can watch from them. Or else if you are not aware of any of these things, so you can watch from the very beginning, because it will have a sequence, a chronology you will understand with regard to this particular information. Fine. So let us first understand these important terminologies, that is, what is the meaning of outbreak, epidemic and pandemic. All of you might know about it, but still those who don't know, for them this particular information. Outbreak is nothing but it is if a disease has infected an area, and slowly the number of cases are increasing. Remember this point. Today 10 cases, tomorrow 20 cases, okay, and day after tomorrow 30 cases. If the number of cases of that particular disease or of that particular related symptoms increased over a period of time, okay, then it is called as an outbreak. If this particular disease is restricted to one particular region, okay, let's suppose Hyderabad like that, okay, or let's suppose India like that, then it is called as epidemic. Means it is designated with or it is attributed to India, and the effect is there only on Indians, like that. So disease affecting in large number and associated with a particular area or a particular region. Okay, then pandemic means the total world. The same disease, if you find everywhere in all the continents, in most of the countries, then it is called as pandemic. Okay, so if you see in a syllogism way, outbreak could be written in this way. Okay, epidemic a larger area, and pandemic even a larger area, but the symptoms and the disease should be same. This is the criteria here. So I hope that you got all the terminologies properly. Now let us discuss about very frequently asked queries to me. So many of the students generally sends me these kind of messages, so they want me to answer it. That's why I have put all those questions, and the detailed official authentic survey I have done on it. So let us see what are the questions and what are the relevant answers we have got. First one is the symptoms of coronavirus 19. Okay, CO means corona, V means virus, identification 19. Okay, so whatever the symptoms that we are experiencing with regard to this coronavirus, so they have got some similarities with the symptoms related to what? Flu, common cold. Okay, let us see what it is. So do we have any differences with that normal common flu that we suffer in our daily life, and also the symptoms of coronavirus D? If any person is having cough and cold, it means he is having only allergy. It means he is suffering from what? Only allergy. If a person is having cough and cold and which is accompanied by fever, then such a person is said to have what? Flu. This is a disease, viral disease. Okay, when a person is having fever also, cough also, but cold is not associated, but instead of cold the person may also see some problem in his breathing. Breathlessness means he is not able to take full breath, or he cannot hold the breath for some period of time, maybe 1 minute or half minute, like that. He is not able to hold his breath, okay, or he is not able to take his full breath. Okay, that situation is called as breathlessness. Generally he takes very short breathings. Okay, so fever he is having, cough he is having, and a respiratory problem, breathing problem he is having, then it is a symptom of coronavirus infection. Okay, I hope you got the differences between the symptoms of allergy, symptoms of flu, and the coronavirus infection. Anybody who do not have any of these three, they don't have to worry about it. So they can consult a doctor and get the medicine, and they can be normally cured as we generally get the treatment in normal days also. Okay, but if it is associated with breathlessness also, then you have to immediately consult a doctor. Okay, you cannot prolong it. Generally, you know that if we are having, right, fine, let us see the next slide. So this is very commonly you might be seeing in the news. This is a thermal detector. Okay, thermal detector, just like a in Holi we use no water cannons, like that. It is just like that. It will measure the temperature of a body. This is a thermal scanner. This technology we are not using because you know that we are not that much of financially well, so we can install all these thermal scanners. So we are not doing it at present, but you know that this is very common, we are doing it. Okay, nothing but this particular equipment helps to determine that a particular person is having temperature more than the normal temperature is with respect to Fahrenheit 98.4, you know that. And with regard to degree centigrade, it is 37 degrees centigrade. Okay, so any of these is normal temperature. If any person is having more than this, then this particular instruments will detect it. Fine, it is just like our normal thermometer, okay, that we generally use to measure the body temperature, no. But thermometer you have to keep it for a long period of time, like 50 seconds, 55 seconds, like that, then you will know that whether he is having or not. And you need to have lots of thermometer at the entrance of airports, railway stations, okay, in order to detect that particular person is having more temperature or not. So instead of thermometers we are using what, this thermal detector. This is called as thermal detector, and this is a thermal scanner. Okay, instead of that we can use thermometers also, but it is a time consuming process, so we cannot use it. I'm just trying to relate it. Okay, what are those, that's all. Now we are having how effective are thermal scanners in detecting people infected with new coronavirus. Okay, they are very much effective because for body temperature they are able to give us accurate values, not a problem at all. So effective in detecting people who have developed a fever, nothing but a temperature higher than the normal body temperature. Okay, and fever is one of the symptom of coronavirus. So this is the one symptom that we have taken into account to detect the people who are having coronavirus symptoms. However, the problem with this particular method, the major drawback of this particular method is once this virus comes into contact with a person, okay, मीन्स जब ये वायरस आपके स्किन और या आपकी बॉडी में इंटर हुआ, okay, so you are not going to see the symptoms of it for 2 to 10 days. Okay, for 2 to 10 days you may see, you may not see. किसी को 2 days में भी symptoms आ सकते, किसी को 5 days में भी आ सकते, किसी को 10 days में भी आ सकते. Suppose a person is coming from UK and he has got infected on the same day, तो वो तो directly pass हो जाएगा because he does not develop any symptoms, right? So the major drawback of this method is it is not a what full-fledged method to know how many people have been what affected by this coronavirus. It will give the correct values of the body temperatures, nothing more than that. So this is the major drawback. Fine, so let us go with another important frequently asked question, that is, can a person exposed to coronavirus transmit it to others if he or she uses a swimming pool? Highly unlikely, not at all. Okay, see, for the swimming pools, generally to clean the swimming pools, they generally don't take out all the water from the swimming pools and put a new water every other day or every other hour. Okay, because it is used by many people. So instead of that, generally what they do is they will chlorinate it. Chlorination of swimming pools happens, okay, on a usual basis. Okay, and chlorination kills this virus. That is a proven fact we are having. Okay, so स्विमिंग पूल्स को क्लोरिनेशन करते, क्लोरिनेशन नथिंग बट केमिकल है, क्लोरीन का केमिकल है, अगर क्लोरीन अगर अपन स्विमिंग पूल्स में डाल दिए तो वायरस ऑटोमेटिकली डिस्ट्रॉय हो जाता. सो इन्फेक्टेड पर्सन, if he is using the swimming pool, the other persons will not get it. So why this particular thing has come into picture means कि बड़े बड़े hotels में the people will come from different countries and they generally go into big hotels and stay there and uses a swimming pool. तो फिर वहाँ पे छोटे छोटे बच्चे भी रहते, फिर वहाँ पे बूढ़े भी स्विम करते, सभी स्विम करते, तो उनको भी एक तरह का इन दे विल हैव दिस पर्टिकुलर एप्रीहेंशन, राइट, कि विल दे गेट अफेक्टेड और नॉट इन दैट वे. So for that purpose this particular information. Okay, so whatever it is, if you have if you have used the pool where you have seen lot of foreigners also use that pool already, so you don't have to worry about it, because for the swimming pool cleaning purpose we use a process called as chlorination, and chlorination kills the virus, maar deta. Okay, then the another important the query that I have got it, should people avoid eating meat based food to prevent transmission? First of all, this has to be understood by everyone that ये एनिमल खाने से, एनिमल का मीट खाने से ट्रांसमिट नहीं होगा. Okay, we have been seeing that from human to human transmission is possible, not from animal to man. ओके, बट ओरिजिन तो इसका जूनोटिक बोल के बोले, जूनोटिक इन द सेंस दैट इफ एनी डिसीज इज ट्रांसमिटेड फ्रॉम एनिमल टू ह्यूमन देन सच डिसीज इज कॉल्ड एज जूनोटिक. ओके, सो कोरोना वायरस का ओरिजिन तो जूनोटिक है, बट एट प्रेजेंट इट इज नॉट ट्रांसफरेबल बाय दी व्हाट मीट. मीट इज डिफरेंट फ्रॉम एनिमल्स वी आर टॉकिंग अबाउट लाइफ. सो वैसा तो हो सकता है, एनिमल्स ट्रांसमिशन इज पॉसिबल, एंड इन दैट nowadays we don't see that also, we'll see only human to human transmission. अगर चिकन या मीट खाने से होता मीन्स नहीं होता, इट्स नॉट पॉसिबल. सो इट इज़ ए रेस्पिरेटरी वायरस है, नॉट ए फूड बॉर्न वायरस. फूड बॉर्न वायरस मीन्स द वायरस दैट इज इन्फेक्टिंग पीपल थ्रू फूड. It is not like that. Okay, so whatever you eat with food and whatever you do with pet animals, you talk to them, you hug them, you play with the pet animals, you eat how much you want to eat, you can eat how much you want to eat mutton also. Okay, whatever you want to eat, how much ever you want to eat, you can eat, not an issue. So it is not going to be transmitted. This is another myth also you can consider in that way. Okay, is there is a link between a person's immunity and coronavirus 19? This is the actually the coronavirus scientific name, so please remember this. Transmission. Okay, 2019 में आया तो वहाँ से आउटब्रेक हुआ. Coronavirus is one of the weakest family of virus. See, this is very surprising to know that it is considered to be the weakest of the family of viruses. अगर हम एक स्ट्रॉन्ग वायरस से इफेक्ट हुए तो यू वुड हैव सीन दैट ये डेथ्स कितने लैक्स में हो जाते थे, राइट? So coronavirus actually belong to a family of weak viruses. So we are at least saved from the God, by the God. The death cause so far affected peoples which are having less immunity, like children and elderly, because children they have not developed the full immunity. That's why they are vulnerable, and elderly they are on a verge of losing the immunity. Okay, so this is the biological changes that happens in a particular individual. It is a very common to each one of us, not an issue in that. So अभी तक जो भी डेथ्स हुए वो चिल्ड्रंस या एल्डरली के ज़्यादा हुए, बिकॉज हम ये अज्यूम कर लिए कि उनकी इम्यूनिटी उतना फाइट नहीं करी. ओके, एंड द वायरस enters into person's lungs and causes pneumonia. Pneumonia is nothing but a respiratory disorder. respiration में प्रॉब्लम होता, हमारे लंग्स में ये फैल जाता, स्प्रेड होता और हमारी ब्रीथिंग को प्रॉब्लम करता. when you know that if respiration is very important to our body, if respiratory problems we are having now, it will have multiple effects on different parts of our body. Because of respiration only the oxygen and CO2 is transported, okay, in and out from our body. And oxygen is very important because oxygen will generally combines with the blood, and blood will have lots of chemicals which are important for our body also. So, and this respiratory organ of our body, that is lungs, will generally work in tandem with heart. तो यहाँ पे प्रॉब्लम हुआ तो हार्ट का पंपिंग भी कम हो जाता. हार्ट का पंपिंग कम हो गया तो when blood is not, oxygen is not circulating in our body, what will happen, हम weak भी महसूस करते हैं and we will be bedridden, that is for sure. So that's why respiration is very important biological phenomena that happens in our body. अब किडनी एक भी नहीं रहे तो एक से चला ले सकते, remember this point. Okay, if urine you are not able to excrete, you have some other way to take out the urine also, that is also there. So like that, for if you don't have one eye also, you can see with one eye, fine. So if you don't have like 4 chambered heart है, एक chamber काम नहीं कर रहा, so we'll go for bypass surgery, right? You can do it. But lung ही एक ऐसी चीज़ है, it's like one important organ of our body which is you cannot survive. Okay, जितना क्वांटिटी में ऑक्सीजन CO2 जाना ओवरऑल इन आवर बॉडी, that much should go, then only it will be helpful, otherwise it is not helpful. And respiratory illness, if it get exaggerated, that condition in we call it as pneumonia. Scientific terminology है, nothing more than that. Okay, people which are having very less immunity, okay, means who are very sensitive to allergies, who are very sensitive to any infections, कुछ भी हवा बदल गया तो उनको बुखार आ गया, कुछ खा लिया तो उनको बुखार आ गया, तो ऐसे लोगों को हम जनरली क्या बोलते बोलते, वी जनरली कॉल देम एज पीपल हैविंग वेरी वल्नरेबल इम्यूनिटी बोल के बोलते हैं, वी कॉल देम एज वल्नरेबल इम्यूनिटी. Means they are having very less immunity, they are not able to fight with the surroundings, even for silly very small things also they will get problems. Okay, for young people like us, like who are in the age group of like adult group, okay, 19 to or 18 to 59 years, this particular group is called as adult group according to our government. For young people which are having good immunity, whose lifestyles are good, they eat all kinds of varieties of foods etc., the virus is not showing that much of impact, उतना ज़्यादा impact वो बच्चों को नहीं हो रहा, because उनकी immunity भी अच्छी है. Another important aspect is ये adult group में तो we have already said that अडल्ट के पास बहुत सारी अच्छी सी इम्यूनिटी है, तो इसको इसके ऊपर इम्पैक्ट कम है वायरस का. बट इफ़ ए अडल्ट इज सफरिंग फ्रॉम डायबिटीज, शुगर है उनको या कार्डियक प्रॉब्लम है उनको, तो ही दे आर ऑल्सो वेरी मच what vulnerable for infection. So seriously उनको भी इन्फेक्शन हो जाता. In the adult group, if anybody is having diabetes or cardiac diseases, they are likely to get affected with this infection very early than those people who are not having any disease history. कुछ भी नहीं है तो कुछ भी नहीं होता. अगर कुछ भी नहीं होता, nothing but नहीं होता in the sense you will not have it, but definitely उतना जल्दी the virus will not act on that particular persons. But those who are having this kind of history, of course, okay, they will show the symptoms and the infections very early. Are there any home remedies to treat this COVID virus? नहीं है, not at all. You don't have. Okay, except the allopathy. Allopathy is a science altogether. If you are going and treating in the allopathic way, then it is okay. Okay, apart from this, ये अजवाइन खाओ, ये अदरक खाओ, ये गार्लिक खाओ, ये खाओ, वो खाओ. In this way, it's not going to happen in any case. So you cannot fight with the virus with this kind of home remedies. Okay. So the best thing is nothing but, the best remedy that is nothing but take precautions. Don't come in contact with the people who are coughing. First of all, that is enough. Again, don't stay with the people who sneezes also. That is also enough. Okay. And when we are saying that don't come in contact with that persons, don't come in contact with the person who are using various things and the utensils. Don't come in contact with that things also. Person and his related touched surfaces, you should not come into contact. That's all. Okay. Then mask पहन लो आप. Okay. So this I will discuss after some time. Okay. So home remedies are not there, that is for sure. Are antibiotics effective in preventing and treating new coronavirus? No sir. Antibiotics, with the name only you can understand. Biotics, bio means living, of course. Bio is also here called as bacteria. So antibacterial drugs हमारे पास है, but antiviral drugs we don't have. Okay, at present we have the mankind has not yet made it. So drugs though we don't have. So antibiotics are generally given. Why? Because when a person is having viral infection, तो उसको bacterial infection भी होने के chances है. मलेरिया, डेंगू ये सब भी होता. So in that way, so आपको वायरल डिसीज भी हुआ, आपको फ्लू भी हुआ, कॉमन कोल्ड भी हुआ, आपको कुछ भी हुआ, जनरली डॉक्टर्स विल गिव यू व्हाट, एंटी बैक्टीरियल ड्रग्स. वे वेरी कॉमन प्रिस्क्रिप्शन है. Okay, but antiviral drugs, we don't have it. No antibiotics cannot do an act against the viruses. Okay, they act only against bacteria. That's all. Means bacterial diseases को ही काम करते. The new coronavirus is a virus and therefore antibiotics cannot be used as a preventive method. Okay, but why they are giving to the patients? Why they are giving to the patients? Why it is being administered to the patient? Means viral infection has a patients को bacterial infection भी possible है. That is why. Okay. Fine. Now let us see another important thing, that is, do vaccines against pneumonia protect you against the new coronavirus? Vaccines तो बना ही नहीं अभी. We have not yet prepared the vaccines. But what we are talking about is we do have vaccines for pneumonia. Okay. This pneumonia मतलब अब देखो respiratory problem we are having, right? So अपने को respiratory problem है तो उसके लिए अपने पास एक वैक्सीन है. तो फिर कोरोना से भी रेस्पिरेटरी प्रॉब्लम हो रहा ना, तो वही वैक्सीन जो भी हम निमोनिया के लिए यूज़ कर रहे हैं, ये वैक्सीन हम एडमिनिस्टर कर सकते क्या, दे सकते क्या पेशेंट्स को? बोलते हो नो, वो अलग है, ये अलग है. ओके, इन्फ्लुएंजा को ही फ्लू, इन्फ्लुएंजा मीन्स इन दैट नेम ओनली यू आर हैविंग फ्लू. फ्लू को ट्रीट करने का वैक्सीन बनाए, बट कोरोना वायरस के ऊपर इट इज़ नॉट गोइंग टू वर्क बिकॉज जेनेटिक कोड होता है. मैं वो in the subsequent chapter I will be talking about the genome sequencing and all. The total lecture will not be only on general information, so it will be very scientific and very complex when we go ahead. Okay, the virus is so different and different that it needs its own vaccine. That is what I am trying to say. The vaccine we have to make a new one, otherwise we would not be having lockdown. हर एक को like पोलियो के जैसा दो बूंद जिंदगी के, like that they used to go and conduct lots of camps in the localities, and every one of us would have got two drops, four drops, whatever the drops recommended by the government. हम फिर भी सकते थे, काम भी कर सकते थे, ये लॉकडाउन की ज़रूरत नहीं रहती थी. दिस कर्फ्यू वुड हैव आल्सो बीन नॉट important. Okay, so no vaccine, that's why we have to discover, we have to research, and we have to produce a new altogether vaccine. Okay, so nothing but you protect your health. So this is a very long video. I hope that you understood. If you have any doubt, please ask me in the comment section. I will be more happy to help you out. In the next lecture I will cover maximum all the rest of the topics. Have a nice day ahead. Please protect yourself. Stay away from those who cough, those who sneeze, and whatever they are touching. Don't be with them for some time. It's okay if you call, and if you do what if you ask them hi, how are you, that is enough. But be safe. Thanks a lot.